Talking health with Dr. Scott Ackerman. A recent study shows that advanced prostate cancer cases continue to rise in the United States in men 50 and older. Researchers found the incidence of the disease was increasing by 2.4% yearly for men 50 to 74, but this more than doubled to 5.6% per year from 2012 to 2015. So joining me now to unpack this is Dr. Scott Ackerman. And Dr. Ackerman, I want to point out my stepfather just died of prostate cancer about a month ago. And I thank God for early screenings because he lived a long time with this disease. But we have seen the recommendations change for when people should be screened. Do you think there's a correlation in these higher numbers with a decline in some of those screenings?
Yes, we absolutely think that. In 2012, the U.S. Preventive Services Task Force came out with new guidelines regarding prostate cancer screening. And the recommendation was a de-emphasis on routine prostate cancer screening. But what happened was, and that prostate cancer screening is with the PSA test. The PSA test is a blood test that tells us if a man has a chance of having prostate cancer or not. When the test is elevated, there's a higher likelihood that he has prostate cancer. So this de-emphasis of the test has led to a delay in diagnosis in a lot of men with prostate cancer. Prior to that recommendation, it was felt that we were overdiagnosing men with prostate cancer and that many men were receiving treatment that they didn't necessarily need, that they had prostate cancers that were small and indolent and would probably never affect their lives. But now we know how to stratify those patients and understand who needs aggressive treatment and who doesn't.
Yeah, and we know prostate cancer is a slow cancer. You know, people can live many years with it. What would you recommend as far as how often people should be tested and maybe even considering those risk factors as well?
Well, I think the risk factors are very, very important in determining whether or not you should be tested. I think a man should have a conversation with his physician about prostate cancer screening. Prostate cancer screening is a digital rectal examination and the PSA test. And I recommend to my patients that once you reach the age of 50, and if you have a normal or regular risk factors, that you have annual PSA testing. If you're at high risk, meaning that if you're African American or if you have a family member who's had prostate cancer, that should begin at age 45. And if you have two high-risk features, like if you're African American and you have a family member with prostate cancer, you should start at age 40. We know that African American men have double the incidence of prostate cancer as non-African American men, and so that this population even needs to be more vigilant in having prostate cancer screening.
Yeah, and to start thinking about that at 40 is young, so you definitely need to have that conversation with your doctor probably sooner than maybe you're even comfortable with. If you do come back and your PSA levels are higher than they should be, what does that mean? And then what is the patient supposed to do?
So if your PSA level is high, then that puts you at risk for having prostate cancer. And so you should see someone about having a biopsy, having maybe some additional testing done. We do MRIs now, what's called a multi-parametric MRI that allows us to look at the prostate good and thoroughly. And then we can do directed biopsies in the prostate in those areas that are suspicious for cancer. But if you're diagnosed with prostate cancer, it doesn't mean you need aggressive treatment. And that's what we understand now, that we have this risk stratification, and we know many men with small early stage cancers do not need aggressive treatment, but can be just monitored on what we call active surveillance, where they're seen regularly and their prostate's checked, and they don't need to have surgery or radiation initially. But there are many men who with more advanced cancers that do need aggressive treatment, which might include hormone therapy, surgery, radiation, or a combination of those things. And by not doing prostate cancer screening, as we haven't done as much in the past 8 years, more and more men are being diagnosed in a more advanced stage where it's more difficult to treat.
Right, and if you catch it early, gosh, you really can prolong your life. And I do want to point out just some of the symptoms: trouble urinating or discomfort in the pelvic area. If you're experiencing those, you definitely want to talk to your doctor. Dr. Ackerman, thank you so much for sharing with us this morning. It is Men's Health Month, and definitely advise our men to take care of themselves so that they'll be here a long time.
Thank you for having me.